what is wrong with this baby.
And I really thought he was going to die.
He was afraid to find out just what it was.
It needs to come out, and it needs to come out as soon as it can.
My whole world just collapsed at that moment.
I think my husband and I cried all night long.
Next, 3 medical mysteries that defied the experts. For 3 years, Mary and Rich Jordan felt completely helpless as they watched their young son's unquenchable thirst slowly destroy him and their family.
We'd seen so many doctors by then, and they all told us he was fine. And I wanted to believe that.
Liz Holzemer wanted desperately to have a baby, but while trying to create a new life, she almost lost her own.
I was like a walking time bomb. I really began to feel there's a missing piece to this puzzle, and I have to find it.
Jerry O'Meara suffered in silence for years with embarrassing symptoms, but when his vision started to deteriorate, it was too much for him to bear alone.
I couldn't take it anymore. I wanted my eyes back again.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Mary and Rich Jordan's daughter was 4 when they decided to expand the family and adopt newborn fraternal twin boys.
The babies were born and placed into our arms, and I can't explain how it felt. It was amazing.
Joey was actually the larger of the two. He was 7 pounds, and Patrick was 6 pounds and 2 ounces, I think. What you picture in your mind of a big baby, they had the roles of little tiny sumo wrestlers, they're just, tanks.
But despite their physical similarities, the twins begin to exhibit very different personalities.
Patrick was quiet, just kind of went with the flow. Joey, even from birth, would cry a lot.
Joe wanted food, he wanted his bottle. He wanted to be fed right away. And he would just suck on the bottle, and then, you'd have to pop it out of his mouth and get him to breathe for a second, and he would just go, and then he'd grab the bottle again and stuff it back in his mouth.
And he'd finish that bottle within a couple of minutes, and then he'd just projectile it out. You would just drape yourself with blankets because you knew the minute you fed him, he was going to vomit all over you.
The boys' pediatrician tells them not to worry. Joey's still eating, gaining weight, and seems healthy. But as time goes by, he gets worse.
He always cried at night, and it got really annoying, and it kept everyone up. And he was always thirsty and always hungry.
There were nights that I'd have to roll Joey's crib out into another room so that Patrick can sleep, because Patrick was sleeping through the night, and I didn't want Joey to wake up Patrick.
He would make a big racket that would wake up Patrick. Patrick is figuring, well, while I'm awake, I might as well have something to eat too. So we would both end up sitting there, and we'd be feeding them at the same time. And whoever had Joe would always get done first. They would have to deal with the throw up, but they would get to go back to bed quicker than the other one.
Joey's appetite is a little strange, but in all other respects, he seems normal.
Everything about him was normal. As the first year was going on, he'd roll over when he was supposed to roll over. He'd babble when he was supposed to babble. He crawled when he was supposed to crawl. But I knew as a mother, something isn't right, but I couldn't put my hand on it.
Gradually, Mary begins to realize that it isn't just the amount of liquid going into Joey's body that's astounding.
We would have to change his diaper at least every 2 hours. A lot of times, I'd put a fresh diaper on him, and as I'm taping it up, pee. And one time of peeing would fill the diaper.
And we would weigh him, and I kept a chart, how many ounces is that diaper, and wow, a new record. Kind of bizarre behavior, but we were being driven to extremes because the situation wasn't getting any better. It was actually getting worse.
When the twins are 6 months old, Mary takes the boys to a new pediatrician. But he doesn't think Joey's odd symptoms are anything out of the ordinary. On the contrary, the doctor tells Mary that she may be the one with the problem.
I went in and I said, he won't go to bed without a bottle. Well, don't give him the bottle. Let him cry himself to sleep. So when I tried to put him to bed without the bottle, and he screamed, and he screamed, and he screamed. I'm surprised neighbors didn't come knocking on the door to see what is wrong with this baby, because you've never heard anything so loud and so horrible. And the doctors were saying that I needed to become tougher and let him do it, but I couldn't. I just couldn't. I gave in and gave him the bottle.
I think a lot of the doctors thought that Mary was nuts. This woman comes in, she's distraught, she's obviously, at the end of her rope. She's complaining about a child that pees too much and drinks too much and throws up. Come on, lady, just relax, take care of your kids.
For 2 years, Joey has always eaten more and been bigger than Patrick. But suddenly, that pattern begins to change dramatically.
All of a sudden, we noticed that Patrick was outgrowing Joey.
Patrick was the linebacker, and Joey was the petite one. Joey was getting Patrick's hand-me-downs.
He stopped growing completely about age 2.
But again, the doctors would say, hey, sometimes that happens. Kids have growth spurts. So he's just at the end of a growth spurt.
We'd seen so many doctors by then, and they all told us he was fine. Even when he stopped growing, they said he was fine. And I wanted to believe that.
Over the next several months, Mary and Rich begin to notice another odd behavior.
He was very active, but he'd rather do things indoors. Did not like to be out in the bright sunlight that much without sunglasses. And we'd go through Batman sunglasses and Teletubby sunglasses and Barney sunglasses.
I thought he wanted attention because I was little and I wanted attention, and I thought he was trying to steal it from me.
And he would lick the back of his hand and then wipe his eyes, or we thought he was doing it to get moisture in his eyes.
Despite this peculiar reaction, Joey doesn't seem to be in any pain, and his vision checks out fine.
And so we just figured he was overly sensitive to the light, and his eyes were dried out because, there was just dry air.
Who are you?
The twins graduate from baby food and bottles, but Joey's taste in grown-up food seems a little bizarre.
Where most kids want candy, Joey wanted to eat salt. And we noticed he'd add salt to everything. No matter what it was, he'd put salt on it.
My sons would look at him and say, "Mom, what is he doing? It's already salty enough." And we would all sit there and just kind of go, "That's really disgusting." But he loved it.
I didn't think it was hugely odd. I thought maybe he had some bad taste buds or something like that. He just didn't get the idea or he liked the flavor of salt.
And if he didn't get the salt, he'd scream or cry. So we'd give in and kind of let him eat what he wanted to eat.
The twins are now 2.5, but the similarity ends there. Patrick has been sleeping through the night for months, while Joey is up 3 and 4 times a night screaming for water. Joey's problems are beginning to take a toll on the Jordans' lives.
Got to the point where we were both totally exhausted.
My husband and I were trying to take turns so that we'd at least get 3 to 4 hours sleep between us.
I don't think she got more than an hour's sleep for years.
And we kept going on the way we were. At 2.5, we were still up every hour or two taking care of him like he was a newborn baby. But nobody could tell us why.
For 3 years, Mary and Rich Jordan have been dealing with their son Joey's bizarre symptoms: an unquenchable thirst, projectile vomiting, excessive urination, and an intense craving for salt. All along, the doctors have told them that he falls within the range of normal. Not satisfied, Mary Jordan takes Joey to yet another pediatrician, Dr. Michelle Ernst.
She was young and friendly. We went through the history of Joey, and she listened to me and didn't say it's your fault.
Mary's manner was one of a concerned mom. She knew something was definitely wrong with her son. When he was in the exam room, for a limited time, it was 15 or 20 minutes that I was with him, he had 4 cups of water in that small amount of time and got kind of antsy if his mom didn't give him water. And I thought, that's kind of peculiar. So it made me think something's probably not right here.
She then did a physical on him and asked, "Has Joey ever been tested for diabetes?" And I said, "No, he's never been tested for anything." And Dr. Ernst then said, "That's the first thing we're going to do because excessive water drinking is a sign of diabetes."
Just a quick urine test that I did showed that there was potentially a problem.
The urinalysis shows that Joey doesn't have juvenile diabetes, but he does have abnormally high levels of sugar and protein in his urine, an indication that there is something wrong with his kidneys.
I knew something was wrong with my child, and she's finally saying there's something wrong with my child.
Dr. Ernst refers them to pediatric kidney specialist Dr. Sheldon Orloff to investigate.
The most striking thing I remember about him and his family is that he came with his twin brother, and he and his twin brother are markedly different in size. It was like meeting Mutt and Jeff.
Dr. Orloff came in and he looked at Joey and talked to Joey.
He's a very reassuring doctor. He's very calm. He knows what he's talking about. It felt really good to have an expert looking at him, because then we thought, we're almost to resolution now.
After hearing the litany of Joey's symptoms and the toll it's taking on the family, the first step Dr. Orloff takes is to prescribe a medication to treat Joey's excessive urination.
That in and of itself was a godsend. If we could get 5 hours of sleep a night, it was just like yahoo.
I wanted to try and show them that we could make their life a little bit better. And at the same time, I introduced this concept that he may have something else going on.
And everything seemed to be going great until he started ultrasounding the kidneys. And in one of the ultrasounds, they noticed that something was wrong with the kidneys.
We therefore proceeded with a kidney biopsy, in which we take a small part of the kidney out, look at it under a microscope, and try and make a substantive diagnosis.
Just before we brought him in for the kidney biopsy, we thought he's losing his kidneys. We didn't know what was going on.
You filter about 40 gallons of water out of your bloodstream every day through the filtering apparatus of the kidney. His laboratory tests showed signs of the filtering not working correctly.
The biopsy shows that Joey's kidneys, which should be absorbing nutrients and filtering out toxins, aren't. Everything is just passing right through them. This is a condition known as Fanconi's syndrome. Fanconi's is not usually a diagnosis in and of itself, but rather an indicator of another, more serious disease.
I was a little concerned, and then I was relieved at the same time, because now they clearly knew at the microscopic level, what the problem was, or at least I thought they did.
So now it was important to try and look at all the possible causes for Fanconi syndrome. One of the major organs that, aside from the kidney, which seems to be the target organ of this disease, is the eye. So I sent him to the ophthalmologist.
We were frightened. Doesn't mean he's going to go blind. So then we were dealing kidneys and blindness. I didn't know. The head of ophthalmology looked in Joey's eyes and within a few minutes said, Joey has crystals in his eyes. And I go, he has what? He has crystals in his eyes.
The ophthalmologist immediately sends Mary back to Dr. Orloff.
And Dr. Orloff had us right in and proceeded to say, your son has cystinosis, this is what it is, this is what we have to do for him.
Cystinosis is a rare genetic disease in which the amino acid cysteine wreaks havoc on the body. In a healthy person, cysteine is gradually absorbed by the kidneys. But with cystinosis, the cysteine builds up and forms crystals, which can lodge in cells and damage tissue.
This is inherited. It's genetic. It comes from a recessive characteristic in the two parents.
The crystals tend to gravitate to the eyes, which causes a sensitivity to light. And the buildup of cysteine in the kidneys means that they can no longer absorb nutrients or water. This leads to excessive urination, which in turn leads to dehydration, low potassium, and a seemingly unquenchable thirst. The inability to absorb essential nutrients can also result in stunted growth, kidney failure, and ultimately death.
So these children typically will crave salt and water to a point that they won't drink almost anything else, and to the point of even keeping them from eating to get the adequate calories they need to grow.
I was so scared. I went home, went on the internet, and the information was very, very frightening. Talking about kidney transplants, they talked about people dying at a young age, and I cried. I think my husband and I cried all night long. I
remember when my sister told me what it was. I was scared. She didn't know what the future was going to hold for him.
Granted, it was not a good, happy diagnosis. At least we know what it is, and we know what we can do to make it better, or at least to make it less damaging than what it was.
There is no cure for cystinosis, but there are medications that can treat the symptoms and help prolong life. Dr. Orloff starts Joey on a drug to reduce the cysteine content in his body, eye drops to remove cysteine crystals in his eyes, and a growth hormone to help him catch up.
Before we understood the disease and could replace the missing chemicals, the children would die within several years. Now that we have the ability to treat the disease, they're living a much longer, healthier, and productive life.
The Jordans are lucky. Cystinosis is a difficult diagnosis to come by.
There are less than 2,000 people in the world with cystinosis. And that's not the first thing that jumps up at a doctor, because most doctors have never heard of it. Dr. Ernst was willing to go in and find out what was wrong. And it was our luck to find Dr. Orloff, who had treated cystonic children before.
You know, we're taught in medical school, common things are common, and you usually think of common things. So you have to be thinking outside the box to get to a rare diagnosis.
Thanks to proper treatment, today, Joey is thriving.
Between the various pills and these eye drops, which he only gets up once or twice a night now, and my son, who would not even go outside in the daylight because his eyes hurt, is now swimming in swimming pools and playing soccer and baseball and everything else.
He will need to take medicines for the rest of his life. Different types depending on where he is in his disease progression. And that eventually he will need to have a kidney transplant. Saying all that, he manages to do pretty well with life.
Joey is one of the toughest little boys I've ever met. Joey will do anything to just get on your nerves. He's like every other little brother.
Finally, the Jordans' sleepless nights have come to an end. And through it all, Mary and Rich have learned a valuable lesson.
You know something is wrong and you need to push forward and work on that.
Go to as many doctors as you need to go to get the diagnosis. And don't take no for an answer.
Joey Jordan's disturbing symptoms began almost from the moment he was born. But Liz Holzemer's problems didn't start until she and her husband Mark, a professional baseball player, decided that it was time to start a little league of their own.
I was 30 years old at the time, and I happily flushed my last packet of birth control pills down the toilet, and I thought, if it's anything like teachers tell you in high school, I should be pregnant in no time. But it just seemed like month after month went by, and I still hadn't had a period.
Concerned, Liz finally makes an appointment with her gynecologist, Dr. Rondi McVeigh, who runs a blood test to check Liz's hormone levels. When the tests come back normal, Dr. McVeigh encourages Liz to be patient.
It'll take the body a little while to get adjusted to being off the pill, to start having regular periods. In the scheme of things of trying to get pregnant, this isn't very long.
But as far as Liz is concerned, it can't happen fast enough.
I knew she was really wanting to get pregnant. I knew she was frustrated. The biological clock was really kicking in.
It was amazing how many of our friends were having kids. So, I mean, it's going to happen for us. It's going to happen at the right time. But after a while, I mean, it really started to affect her.
I was very anxious, and I remember Mark was on the road at that time, and he would call every night and ask me, well, how are you feeling? And I said, well, just keep your fingers crossed, and hopefully it will work.
A few more months go by, and Liz still hasn't had a period. She goes back to Dr. McVeigh, who decides to inject her with the hormone progesterone to see if it can trigger ovulation.
What ovulation means is that an egg in a woman's ovary needs to mature to the point that it can be fertilized. And she was not doing that. She was not ovulating.
Dr. McVeigh also suggests Liz try an oral fertility drug to induce ovulation, but it has significant side effects, and Liz is not ready to take that step.
It was really frustrating not knowing what was going on with my body and why I couldn't become pregnant. It just didn't make sense. It seemed like the summer that everyone was having a baby, except for me.
The past year has felt like an eternity to Liz Holzemer. She desperately wants to get pregnant, but has been told that she isn't ovulating. Now she's starting to wonder if the anxiety of it all is beginning to affect her physically.
If I got up too quickly, I'd have a dizzy spell, but I didn't really think too much of it at the time. I just thought, well, maybe it's the fact that I'm just really worried about trying to have a baby. So I just kind of kept it to the back of my mind and thought, well, I'm not going to worry about it right now.
But soon, Mark sees the warning signs with his own eyes.
We used to go see movies a lot, and when the show was over, we'd get up, and it was still dark in the theater, and she would always stumble. I really didn't think much of it, and I don't know if she thought much of it.
Gradually, the dizzy spells become more intense.
It was almost like if I were to have an acid trip, that's what it would be like. Just colors would become more vibrant and brilliant. If I looked at, trees in the backyard, it was almost as if the leaves would start to move and come to life. They would come on so quickly, and then as soon as the onset began, it was just over. And afterwards, I would just feel fatigued, and then it would just subside, and I thought, maybe it's just the stress, or I spent too much time being out in the sun today.
Then, suddenly, the hallucinations give way to excruciating headaches.
The headaches just knocked me down. I remember one evening where I just had the most excruciating migraine I had ever experienced in my life.
She had never had migraines before, and she could hardly raise her head, and it was really bothering her.
But because I never lost consciousness, I thought, well, it can't be that serious if, I haven't fallen over and collapsed.
But within weeks, Liz notices that she's changing mentally as well as physically.
I had no desire to get out of bed. I declined to go out with friends, and I knew just as well as they did that wasn't the Liz they knew, or I knew. Those feelings of depression really started to scare me.
Liz wasn't the happy person that she was when I first met her, and I was concerned about that change.
I remember meeting with a doctor, and I was given a prescription for an antidepressant, but it only made me feel worse.
Liz attributes the depression to her infertility and makes an appointment with her gynecologist. Dr. McVeigh orders a more in-depth examination of her uterus and fallopian tubes, as well as tests for Mark. When all the tests come back normal, Liz finally decides to try the oral fertility treatment.
After the oral fertility treatment failed, I just thought, what can it be?
At that point, I labeled her as unexplained infertility, and I referred her on to the fertility specialist.
Based on her previous test results, the fertility specialist diagnoses Liz with hypogonadotrophism.
He said, basically, Liz, your ovaries have prematurely shut down. Your best and only chance of having a child safe for adoption is through in vitro. And I was just devastated with the news. I thought, how can this happen?
She wanted to see if there's anything else we could check into.
I really, really began to feel that there's a missing piece to this puzzle, and I have to find it.
In January of 2000, she came back, and I was actually just talking to her before the exam, and she says, I've been really dizzy, I've been tired, I've been having these headaches.
I just said, is there any way we can have another test, a CAT scan, an MRI?
After Liz and I discussed her dizziness and headaches, we decided it was time to move to some further studies.
2 days later, Liz has an MRI. She wonders if it will be just one more test that comes back normal.
The phone rang. All I heard on the other end was this even gravelly voice saying, I have your MRI results. My heart just started pounding. This voice just continued, and it said, you have a meningioma. I'm like, a mini what? What is it? I opened up my nightstand drawer, and I pulled out a lip liner, and I just said, can you just tell me how to spell that? And he said, you have a brain tumor. My whole world just collapsed at that moment.
A meningioma is a common type of slow-growing brain tumor that is rarely cancerous. It forms in the dura, the membrane that covers the brain and the spinal cord. As a meningioma grows, it puts pressure on the brain. Depending on its location, it can cause anything from personality changes to motor difficulties.
Suddenly, I had a neurosurgeon, and I was going to meet him today.
Well, it was a tumor that measured 5 to 7 centimeters in diameter, so it was quite a large tumor.
I just remember Dr. Fulliger just illuminating images of my brain all around his office.
I said, holy is that the tumor? I can't believe that.
It had pressed my brain all the way to the other side.
The pressure on her brain was causing her dizziness, hallucinations, headaches, and depression. It was also pressing on Liz's pituitary gland, impairing the production of the hormones that cause ovulation.
He said it needs to come out, and it needs to come out as soon as it can.
The idea of brain surgery was horrifying. I literally did not know would I come out after surgery.
But Liz has no other choice. The tumor has to be removed.
It was February 10th, 2000, and I had to check into the hospital the night before my surgery.
I didn't really ever think that I was going to lose her until before they took her away. The last thing I said to her was, next time we're in the hospital, it'll be because we're having a baby.
And I just took those words with me as I was being wheeled away.
Liz Holzemer has just discovered that the hallucinations, depression, and infertility she's suffering from have all been caused by a massive brain tumor.
Instead of having a baby grow inside of me, I have another growth, but it's in my head.
We didn't talk about pregnancy anymore. Our main focus was on that tumor and getting that out of her head.
Her only option is brain surgery.
So the goal of the surgery is to remove the tumor entirely. As the tumor gets larger, the technical aspects of removal of the tumor increase in difficulty. We make an incision and have to remove a sizable piece of the skull to access the tumor.
And I was a nervous wreck, you know, I'm walking around, trying not to think about stuff. My whole family was there, Liz's family was there.
I think our anxiety was high, but his had to be so much higher.
It will take 12 grueling hours to try and remove the enormous tumor.
When I woke up, I was just elated. I was alive. They took it out, and I survived.
Liz spends the next year recuperating.
It was the recovery that, for me, it was sheer hell. I was languishing on the couch, and I just wanted to get back to my life the way that I had known it before.
A year and a half after her surgery, Liz goes in for a routine appointment with Dr. McVeigh.
At her annual exam visit, she mentioned that she had been having periods for 3 to 4 months, but the one that was due had not come.
And I felt just incredibly fatigued again, and I was becoming really emotional and irritable, and I just thought, oh, what's going on with me now?
So we were both worried, is the brain tumor coming back? We decided to do a blood test. They called me with the results that evening, and then I called Liz at home.
Liz, I have some great news for you. You're pregnant. Congratulations. I literally just fell over, and I said, are you sure you're looking at the right chart?
I was really excited, and I was very glad to be able to call her.
I couldn't believe it. I was finally going to be a mom.
It was one of the best days of my life. I mean, to go through what we went through, to have all that happen and to have something, you know, magical come out of it was awesome.
A year and a half after her daughter's birth, Liz finds out she's pregnant again, this time with a son.
So I feel doubly blessed that I have these two miracles. They saved my life, because had I not been trying to have a family, I would never have discovered that I had a brain tumor, or it would have been discovered too late.
With Liz, there was no reason to suspect a brain tumor just because she wasn't having cycles. Nobody would have thought brain tumor at that point.
It just makes you wonder how many healthy people are out walking around harboring a life-threatening illness.
In Liz's case, she was fortunate they discovered it when they did.
The brain accommodates to a tumor growing slowly, and it will accommodate and accommodate, and then it can't accommodate anymore, and then it can compromise the brain to the point where the patient can't survive.
Today, Liz's prognosis is good. Still, she must continue to get yearly MRIs to make sure the tumor does not return.
The longer the MRI scans are stable, showing no evidence of recurrence, the better the prognosis. I mean, I would say at this point, her prognosis is very good.
It's good to see her thriving. It's good to see her enjoying her kids.
Hannah and Hunter, what can I say? They're healthy and they continue to be the blessings in my life who saved my life.
Whenever Liz Holzemer had a problem, she went to her doctor. But when Jerry O'Meara first got sick, he refused to seek medical help. He was in his early 50s, working construction, when suddenly something strange happened.
Just trying to hold nails, pound nails. All of a sudden, my hands would just cramp up, and I'd have to stop and kind of work the fingers and work them loose again.
Jerry's fingers would start to swell up, and we didn't know why. He couldn't move his fingers, and his joints were sore.
I just thought it was arthritis. A lot of people get arthritis. I didn't go to the doctor. I figured that I could take care of it myself.
For the next 3 years, Jerry's pain persists and gradually begins to spread throughout his body.
It got down into my legs, and there's times the back of my legs were so painful that I just could not walk.
It was terrible. I would have to put the compresses hot and cold. I would massage them. It would take forever to get rid of the pain.
I would take 8, 10, maybe even 12 pills a day to relieve the pain.
Then, when Jerry turns 55, suddenly he's stricken with devastating stomach problems.
I would eat, and then it'd just start going straight through me. I wouldn't retain the food or anything.
Then he started losing a lot of weight, a lot, fast. You could see the bones and the veins in his arms. His legs were like bird legs.
When I'd look myself in the mirror, I'd see my ribs sticking out, and I thought, man, I don't even want to look at this.
Over the next 2 months, Jerry drops almost 40 pounds. But he's so embarrassed about his symptoms that he refuses to talk to anyone about them, not even a doctor.
I more or less kept it to myself. To me, it would be embarrassing to talk about.
He's a proud man. I'm sure that had a lot to do with it.
I thought, I'll just take care of it myself and just keep my mouth shut.
I think Jerry was really scared, and he was afraid to find out just what it was or how bad it was.
Linda would keep telling me to go to the doctor, and I keep telling her that I wasn't gonna go.
It got so bad that I couldn't take him sitting and whining and crying on the couch day after day after day, because it was affecting me. It was making me a nervous wreck, and I just couldn't handle it anymore.
We just started having arguments back and forth, and it was just a breakdown in the marriage.
It caused us to get a divorce. I didn't know what to do anymore for him. I couldn't help him. He didn't want help. Jerry just wanted to be left alone. So I left him alone.
For the past 6 years, Jerry O'Meara has been plagued with horrific joint pain and severe stomach problems. His mysterious illness has taken over his life and ruined his marriage. After his divorce in 2001, things only get worse for Jerry, when suddenly his eyesight starts to fail.
Reading the newspaper or anything was getting blurry. I noticed that things in a distance, I couldn't hardly make them out.
Despite these symptoms, Jerry still refuses to see a doctor.
Jerry called me up and told me he would go to the drugstore and buy heavy reading glasses to see if it would help, but it just kept getting worse.
He was not working because his eyesight wouldn't let him, and he was just not capable of taking care of himself.
Jerry finally makes an appointment with an optometrist who prescribes stronger lenses. But after just a few days, his vision gets even worse.
People would walk in and they'd say hi, and I'd look at them and I'd say, who the heck are you? I couldn't recognize anybody. All I could make out was a silhouette of the person.
If we'd be sitting in the kitchen, we would say, "What time is it? I cannot read this." So we'd have to tell him what time it was. Reading the paper, impossible. Watching TV, impossible.
Afraid he might be losing his eyesight, he makes an appointment with ophthalmologist Dr. John Kitchens.
I remember when I first saw Jerry, he was kind of slouched over. He was a tall gentleman, but very thin, almost frail looking at that point. You almost had to drag answers out of him. He just was very stoic, and you could tell there was something wrong with him.
I went in and Dr. Kitchens looked at my eyes the first time. He was bound and determined to find out what this was.
Dr. Kitchens notices a problem immediately. The interiors of Jerry's eyes are inflamed.
Dr. Kitchen took pictures of my eyes from inside out to every which way you can imagine. I've had so many bright lights shined in my eyes that it started hurting.
Generally, when you see inflammation within the eyes, it can be from an infection such as syphilis. There's tuberculosis, which can be from an inflammatory condition such as sarcoidosis. So we tested him for all of those things early on with both labs and imaging with x-rays and whatnot.
Dr. Kitchen's main concern, he was not going to give up until he had a solid answer.
But while waiting for the answer from Dr. Kitchens, Jerry's eyesight deteriorates even further.
I'd be walking down the street and I had a hard time seeing the sidewalk that was under me. That was the scary part. I thought I was going to go blind.
He couldn't navigate the key in the lock because it was just too blurry a vision for him, and it kind of freaked him out.
I was at the point where I couldn't take it anymore, the stress and the anguish. I wanted my eyes back again.
Jerry rushes back to Dr. Kitchens' office. When he arrives, Dr. Tom Oding, the head of the eye clinic, immediately takes Jerry into an exam room.
Jerry's not the sort of fellow that complains a lot. And so the fact that he came in to this non-scheduled appointment is telling us with as much force as I think Jerry could that he was concerned and having trouble.
Dr. Oding performs a thorough examination of Jerry's eyes.
He had a significant loss of vision, and he wasn't even able to see the largest letter on our chart.
It was just a grayed out area. I couldn't see nothing.
And at that point, we knew that we had to turn up the heat on figuring out what was going on with Jerry.
When all the tests come back negative, the doctors are baffled. The only diagnosis they can think of is terrifying.
It was obvious that the inflammation was getting worse, that his condition was getting worse. That's when we started to think maybe this was the intraocular lymphoma.
Intraocular lymphoma is a rare type of cancer that starts in the eyes and quickly spreads to the brain.
And if it is lymphoma, there's nothing they can do.
For the past 6 years, 59-year-old Jerry O'Meara has been quietly suffering from inexplicable joint pain and stomach problems. But when his vision starts deteriorating rapidly, he seeks help. His ophthalmologists fear that he may have a rare form of eye cancer, and that the answer may have come too late to save his eyesight or his life.
Intraocular lymphoma typically has a very poor prognosis, so it's something that we all had hoped Jerry wouldn't have.
Jerry undergoes an MRI, which comes back negative for intraocular lymphoma. But an MRI can't always detect this type of cancer. A more definitive test is an eye biopsy. Although it's risky, the doctors have no other choice.
He just began to look worse and worse, and I really thought he was going to die.
The depression state started setting in really good then. I was scared that it's just a matter of time that I'm going to rot away.
Jerry was always scared. He wouldn't show it, but you could see it in his eyes.
But in the days before the procedure, Dr. Kitchens makes a discovery that he thinks might change everything.
I never really questioned the diagnosis of lymphoma. We were all kind of going along with that plan to proceed with the vitreous biopsy. And I happened to be in our library, and I read a book on inflammation in the eye, and one of the authors of the book went on to a description of Whipple's disease.
Whipple's is an extremely rare infectious disease caused by the bacteria Trophorema whippleyi that is found in the soil of some warm climate areas. The Whipple's bacteria first attacks the joints, eyes, and intestines. Left untreated, it can spread to the lungs, heart, and brain, and can be fatal.
But I thought, boy, You know, this really fits with Jerry, but I don't know that he has the gastrointestinal manifestations of the Whipple's disease.
Yet Whipple's affects only 2 in a million patients, and Dr. Kitchen's colleagues think the young doctor may be fooling himself.
My first reaction to John was, you know, you've been reading too much. Forget about these rare diagnoses and maybe go home, go to sleep. Because it just didn't make sense that we would be the one case in the whole world this year that was going to have a Whipple's.
But Dr. Kitchens is convinced he's onto something. He suspects that Jerry might not have told him about certain embarrassing symptoms. Now he needs all the facts.
Jerry came back in, and we asked him if he was having any stomach issues. And initially he said, "No, everything's fine." Then, after more persistent questioning, he told us, "I've had this diarrhea for 3 years."
The more we listened to Jerry, the more we listened to Dr. Kitchens, the more sense it made.
The doctors order an endoscopy and a small bowel biopsy to test for Whipple's.
I remember I was in clinic seeing patients, and I got a phone call from the gastroenterologist. And he said, "We just got Jerry's biopsy results, and I've got to hand it to you guys down there in the eye clinic. It's Whipple's disease."
I was absolutely elated. I was surprised. I was excited. I thought it was one of the most interesting things that I'd heard in years.
It's not like the lymphoma that's going to be fatal. It's something that can be treated, and Jerry can get better.
All I knew is the man said, "We can cure this." And I was one happy fella.
He was very happy in his own Jerry stoic sort of way.
The treatment is astoundingly simple. An antibiotic, which Jerry takes twice a day.
So here we went from thinking that Jerry had this horrible cancer to just giving him some antibiotics.
The relief is immediate.
When I started taking antibiotics, I could start feeling my stomach pain and pressure within about 2 weeks starting to subside. Things were getting better. The diarrhea's gone, the weight's coming back, my eyesight's good.
And it meant a whole new life for Jerry, basically.
If not for his doctor's persistence, Jerry O'Meara might not be alive today. Whipple's disease is a complicated diagnosis to make.
Whipple's disease is difficult because it involves many systems. And so it involves your stomach, it involves your central nervous system, your joints, your eyes. And oftentimes you'll go see separate doctors. You might not think that they're related. You might not tell the eye doctor that you're having stomach problems or vice versa.
If Jerry hadn't been diagnosed at the time that he had, I believe that this probably was progressing into the later stages of Whipple's disease and could have become fatal in Jerry's case.
But now, 5 years since his diagnosis, Jerry is 65 and doing great.
He's going to be on long-term therapy, and he will be monitored long-term to make sure that this doesn't recur. But Jerry has an excellent prognosis.
Jerry's back to his happy-go-lucky self. I can't live with him, and I can't live without him. He'll always be in my life.
I went from dang near being dead to having a new life and just start getting on with the second chance, I guess.